An abnormal heart rhythm can be either due to a rhythm that's too fast, which is called a tachycardia, or too slow, which is called a bradycardia. Now we're going to focus here on the tachycardias, which are the fast heart rhythms. And typically you feel palpitations or a sense of a rising sensation in your heartbeat or an irregular type of heartbeat. The most common heart rhythm abnormality is called atrial fibrillation, and this is where there is a chaotic, random series of activations in your heart that makes your heart feel like it's flip-flopping in its rhythm in the chest. The other types of heart rhythm abnormalities we would encounter in order of how common they occur would be atrial flutter, an SVT or a supraventricular tachycardia, and this is the medical terminology to describe when you have a fast heart rhythm due to the top chambers of the heart beating very quickly. And the forms of SVT that we talk about are typically Wolff-Parkinson-White syndrome, where you have an accessory pathway or connection between the top and the bottom chambers, or a second form of SVT, which is called AV nodal reentry tachycardia, which is also known as AVNRT. So in summary, the heart rhythm abnormalities that we might encounter are firstly atrial fibrillation, which is the most common, atrial flutter, and SVT, which can comprise of Wolff-Parkinson-White syndrome or WPW, or an AV nodal reentry tachycardia or AVNRT syndrome. And those are the essential heart rhythm abnormalities in terms of the tachycardia that you might encounter. Now we understand atrial flutter causes palpitations, but what triggers atrial flutter are typically a patient who has a history of hypertension, of valve disease, and one of the emerging risk factors that we see with atrial flutter is sleep apnea. Now sleep apnea in itself is a disorder of sleep where if you're lying in bed at night, and particularly if you're slightly large and a snorer, you obstruct potentially your airway several times in a night, and this causes an acute rise in adrenaline every time you have to wake up from the obstruction of the airway. You trigger changes in the lungs, which then feed back into the heart, that causes a stress in the heart. Now, as the heart is affected by sleep apnea and the stresses and strains of sleep apnea, what can emerge is the propensity of the heart to develop conditions such as atrial fibrillation and atrial flutter. So one of the emerging things that we're seeing with the epidemic of atrial fibrillation that we're seeing as well as atrial flutter is that more and more patients should really be screened for sleep apnea, and effective treatment for their obesity, for their sleep disorder can be a very important management strategy in helping to improve the outcomes from atrial fibrillation and atrial flutter. The major symptoms from a heart rhythm abnormality would be palpitations. Now, what are palpitations? These are a sensation that you might have that your heart is not beating in rhythm, so an irregular heartbeat or a very rapid heartbeat, which can be either sustained or it can be intermittent. This would be one of the major symptoms of a heart rhythm abnormality. If your heart rhythm abnormality is sustained, or if your heart is beating very quickly due to an arrhythmia, then what you might also start to experience are symptoms of chest discomfort, lightheadedness, shortness of breath, in addition to the palpitations that you might experience. In order to make a diagnosis of a heart rhythm abnormality, doctors typically need to see a symptom to ECG correlation. Now, what is an ECG? An ECG is an electrocardiogram. It's an electrical recording of your heart, typically made from electrodes that are placed in your chest wall and also your arms and your legs. And this typical pink sheet of thermal paper that comes out with the squiggly lines record your 12-lead electrocardiogram or ECG. And the best way that we can make a diagnosis, and the most accurate way to make a diagnosis, is in order for you to have an arrhythmia captured simultaneously at the time that you're having an ECG recorded. Now, this is often easier said than done, because how often is it that you walk into your cardiac diagnostics laboratory and happen to have a heart rhythm abnormality when you're recording your ECG. And this poses a problem for most people to be able to capture this heart rhythm abnormality. So what are the solutions that are available to try and capture something that happens intermittently? And for this, we have other diagnostic tests. One of the most common ones we use in cardiology is called a 24-hour Holter recording. And this is where you're connected to typically 3 ECG electrodes, and you go home with it for either 24, 48 hours, or sometimes 7 days. And if you continue your normal activity and you happen to record or experience one of these heart rhythm abnormalities, then the continuous recording that the Holter performs will be able to accurately give you a diagnosis. Now, what happens if your heart rhythm abnormality occurs, say, once every 6 months? This is one of the great frustrations in the past for patients and physicians to be able to capture a diagnosis. And what we have now is actually something that is empowered by mobile technology. And this is what it looks like. To have with me what we call a mobile 2-lead ECG recording device. And this particular device is called the AliveCor Cardiomobile device, KARDIA. And it's very effective because you can buy this yourself at home and you can couple it to a phone. And here I happen to have an iPhone, but this works on any modern phone. And if I now hold this electrode in my fingers, and I'm going to show you a screen very shortly, you can see the beginnings of the recording of an ECG. And this is my ECG live being recorded at a time of my choosing, because I can always have this gadget in my pocket and coupled to my phone. And when I record such a trace which captures some of my heart rhythm abnormalities, I can bring my phone with the data available on the phone to show my physician. And if your physician is somebody like an electrophysiologist who can read this single lead ECG, the diagnosis is often very clear. Technology companies are now catching up with AliveCor, and for example, the Apple iWatch Series 4 or 5 has this ECG technology. It's a very expensive ECG and may serve other functions such as telling the time, but it will be able to get you an ECG of sufficient medical grade for your doctor to make a diagnosis of a very rare heart rhythm abnormality. And so I'm getting more and more patients who come into clinic with their own ECGs, and I'm comfortable making a diagnosis on the basis of this mobile technology enabled direct recordings of ECGs that are crucially, importantly, done simultaneous with your actual symptoms of palpitations. And that is how we're making more and more diagnoses, for example, of atrial fibrillation, which is incredibly important to make.